All right. Today joining me is Dr. Nicholas Newstrom. Nick Newstrom, a former student of mine. Nick is a assistant professor of marriage and family therapy at Syracuse University in upstate New York. That was my alma mater. I'm so glad that Nick is there and happy to have him with us today. Hey, Nick, tell us a little bit about how you became an MFT, how you found MFT, how you think, how systems theory maybe spoke to you. What was your journey to getting here?
Sure. I think my journey to MFT is really by accident. After I graduated with my undergraduate in psychology, I knew I wanted to be a therapist. But I looked at what was going to take for me to be a psychologist, and it was so daunting, so intimidating. And so I thought, well, what is the pathway of just doing this work by getting a master's? And so I actually just were calling up programs and I talked to a program director in the Twin Cities, and she told me the differences between MFT licensure, LPCC licensure, and social work licensure at the time. So I fell into MFT by accident because I chose MFT because the license was so strong in Minnesota. And I knew that if I became an MFT in Minnesota, that I would be easily able to be under insurance panels here in Minnesota. But as soon as I started taking my classes, I really just became fascinated and fell in love with all of these models of therapy, emotion focused therapy, narrative therapy, collaborative family therapy. I felt like each model was just another tool that I could have in my toolbox that I could use with the patients that I'd be working with. The other thing that I didn't really even consider was the ability to work with couples and families. And so the fact that part of my work, I can help not one, but more than one person at a time is really, really rewarding, really cool. I would say probably, um, I practice mostly. Okay, let me back up. And the clients I see are mostly couples, so I'm probably doing like close to 90% of couples therapy work. And the couples that I do see, I'm using emotionally focused therapy. And the reason that I use that model is it really, really speaks to me. And it really speaks to me because EFT talks about when couples are fighting, when there's conflict, there's an attachment injury. Sue Johnson, really the founder of EFT, was really interested in attachment theory and attachment styles. And that's what informed her model. And why that speaks to me is a couple reasons. Number one, I'm adopted. So I do have this sort of story in my life looking at attachment and has attachment shaped how I connect to my own family of origin, but also others in my life. Number two, as a researcher, some of the work I've done has been in attachment, specifically looking at the attachment styles of adolescents who commit sexual abuse. I think it's really interesting that we talk about this concept of attachment, and yet nobody's training us on how to do an attachment inventory. The adult attachment inventory is something that's a valid measure that really does you really are able to really drill down to someone's attachment style. It's a very tedious assessment tool because it takes multiple hours. There's hundreds of questions that you got to ask somebody, and then they're almost qualitative because you have to code these interviews later to pick out a style. But we know that attachment's real, that these styles really drive us. And to see that applied in a model with EFT is really great. So what I like to do with couples is really look at when I'm first meeting with them, try to get a sense of their attachment style as a couple, and then look for those injury points. And when I'm finding an injury point, what I'm doing with EFT is I'm helping to number one, kind of get them to kind of show those wounds where they are during those arguments. And then I'm trying to get them what's called heightening, which is getting them to slow down, getting them to talk about the emotions that are coming through that underlie these attachment injuries. Because oftentimes with couples, you have these injuries, and what comes out is anger, reactivity. And what you want to do to repair that is really get them to talk about that hurt, to maybe even sometimes make those connections between what's happening with their partner and how that might be stirring up things related to their attachment style growing up. And so when I'm doing with couples, I'm getting them to slow down, pay attention to their bodies. I might be saying things like, gosh, you're really upset, and you're crying. Like, where are you feeling that right now, physically? And I noticed that, your partner over here, they're trying to reach out and comfort you. I'm just wondering, like, how does that make you feel when they do that for you? So
Mhm.
those are the things I'm really, really primarily interested in doing that I try to do with all my couples. EFT is a wonderful modality. Really, you can use it with across all population types. So same-sex couples, trans and non-binary people, cisgender people, of course, as well. And so it's a really good job, I think, of why I like it is it allows me to slow down those tense moments and really pay attention to how can each partner repair those things. And then what's really important for me in my theory is I like to believe that I don't want a couple in therapy with me all the time. Because if they're in therapy with me every single week, that means they're not getting better. Things aren't getting better at home. So I'd like our sessions to really be a place where people feel safe, where people can be vulnerable with each other, and that this is an isomorphic process, meaning they're taking what they're doing in my office, they're going out to their life at home over dinner, putting the kids to bed, whatever, and they're able to really catch themselves and identify those hurt moments and to really work on those repair. And one thing that's very, very important to me is, and I think this really comes from also being a person of color and being, having some uh, not okay experiences with people in authority, particularly healing professions, that I really, really, really strive to make therapy a safe place. I believe it's my responsibility as a therapist to really create an environment where people who might be afraid to come to see me or be afraid to, maybe there's some iatrogenic trauma that they've experienced with a previous therapist or doctor, that I'm making it a space where they feel it's okay to be vulnerable and practice some of these skills that we're talking about. So I really, that to me, I truly believe that it's my responsibility as a therapist to create that environment. Yes, I know clients need to take risks and do some of that work themselves, but me being the clinician, I have to take the lead to doing it. Um,
So much, Nick, so much of what you talked about just now stems from your own. I mean, you led out with, "Hey, I'm adopted." I that throws into my life all these questions about attachment and my identity and things like that. So much of your identification with EFT and with an attachment-based approach is related to yourself. Can you talk a little bit more about the self of the therapist, how that shows up, how that shows up in session?
Sure. It's really interesting when you read literature on therapy, and they're talking about the therapeutic alliance and that therapeutic relationship. I've seen it in many textbooks. It says the therapeutic relationship, it's a real relationship. It's special. So that means that I'm having an attachment. There's an attachment forming between the client and myself. Now, obviously, it's something that is very different than a romantic attachment or attachment between a friend or a family member. But like that is so important to me because, from our models, from common factors, what we're finding out, right? What is the catalyst for change? It's that therapeutic relationship. So I'm constantly paying attention to that attachment with the client. I'm making sure that they're feeling it's a safe space. So these things, the change process can take place, right? I'm trying to make it so I'm showing up with the client in a way that sometimes it creates routine. it creates safety, it creates where we can say things to each other, or say things to a partner that might be difficult to hear. And I think all of that kind of flows back to an attachment, a therapeutic relationship, an attachment, if you will, with a client. Because sometimes when I get stuck, because we all, in the course of therapy, there are moments where we get stuck, we can go back to the relationship. And I can say things, it can be really powerful. I can say things like, gosh, I've been working with you guys a long time, and to see this thing show up, it surprises me. Maybe it's a behavior with a couple like I'm disgusted with. Wow, I can't believe that you're choosing to treat your partner like this. Um, Sometimes I can use it as a way to really highlight some things. Being on this journey with you guys, reflecting on this bond that you've created, it's pretty amazing. I can't believe, you guys have put in some really hard work here. So I'm using that attachment relationship with the couples, that therapeutic relationship, to be a catalyst here for change, to call things out sometimes, both positive and negative, right? Because you do that in a relationship that feels safe. You do that in a relationship that has meaning, that where you have a bond where you can say like, gosh, this behavior, I don't like it, or it shocks me, or I
Yeah.
really like this part, or you're doing really well here.
I mean, you're really showing up in that space as yourself and using that relationship that you've developed as a point of leverage to influence client change and to talk about client change. Is there a do you identify as an EFT therapist, or do you more identify as like someone who is guided by attachment theory principles? How do you think about it?
I would have to say the latter.
Yeah.
I think like even in my individual, when I'm working with individuals, it's the same thing. Like making sure it's a safe space, creating that attachment with the client, creating that relationship. It helps in different contexts, whether or not like I'm working with somebody, well, a couple, right, or an individual, whether they have, maybe historical trauma, or perhaps there's a lot of my work is a lot of sex therapy with people, and individually, I work with a lot of people with compulsive sexual behaviors, and so my individuals, that is, and so again, it's a condition, it's a set of behaviors that is causes a lot of shame, and from if I am I able to build that attachment relate that therapeutic alliance, that relationship, I'm able to explore the mechanism that influences someone to act out sexually, and explore ways to put in a healthy behavior to so someone isn't always sexually acting out.
Yeah.
So I would have to categorize as more of a ladder, but it just with couples, right? It's just it flows so much together in how I think about relationships, especially the couple relationship.
Is there a well-known intervention that you like to use with couples? Could you describe an intervention and how you employ it, how it lands on couples or your clients?
Yeah, I would have to say probably enactments and heightening. So an enactment is you're kind of, I'm not there when these fights are taking place. So you kind of, the first parts of EFT is helping identify like the negative interaction pattern between the couple. So you're having them kind of bring up a conflict and seeing, their pattern, or their dance of what they're doing. And the heightening piece is like, when I'm with a person, and maybe they're glossing over a particular hurt, a particular trauma, but I think it's really important that, and I think it's really important that the client's partner hears this. I'm trying to heighten that emotion. So I'm saying things like, um, where do you see it in your body? I might be talking to them about how that feeling might be related to a previous hurt or a previous attachment injury that I know they've experienced in their other life. And what I'm trying to do is bring that almost to the surface. I'm raising it up to a level so they're able to share that with their partner.
Is that the
And that's kind
heightening?
of
I mean, you lift
heightening.
you're heightening that.
Yeah,
experience, right? It's
exactly.
centering it and making it more prominent, underscoring it, highlighting it, kind of a thing.
Exactly. Yep. Because a lot of times those emotions that need heightening are things that we gloss over or we minimize, or maybe we don't want our partner to see. And that's where my role comes in to kind of make that a safe space, help them kind of raise it up so they can share with their partner, like, when we fight this way, it triggers this piece of me, this piece I don't want you to see that I gloss over, that's really hurtful. And for them, their partner to gain some insight and to be like, gosh, you know what, when I go for the jugular in this particular situation, it's not just getting me what I want, it's really damaging this person and it's damaging a relationship as a couple. So that would be probably like the two biggies, I guess, when it comes to EFT that I typically use.
Yeah, so the enactment, I always attribute enactments to like structural family therapy, where it's like
Yeah,
I want you to have that same conversation, but do it this way. I kind
just
of
to
think
say, yeah.
like a director of a movie, right? This time more emotion. This time you're standing over here. So that enactment, so that you can be present when they have their process come out, and then heightening, bringing to bear and kind of underscoring those emotions that maybe are not so present when they're in the middle of their process.
And Steve, that really just jogged something with me when we were talking about attachment. When they're having these fights, like when I'm not there, it's scary. It's something that's happening really fast. It's reactive. They're not paying attention to it. But having a third person just kind of be there, having like a secure sort of base that
Mm.
I'm not gonna shame them. I'm not gonna raise my voice or kick them out of the office, right? Like that, I think can be so comforting for couples too.
Yeah.
Because again, it's people will feel safe in those secure attachments, those secure relationships. So leveraging my relationship to kind of do that, to inject myself, to kind of say, gosh, maybe there's a different way to respond when this damaged piece of you is kind of triggered here.
That's fascinating, and I really resonate with that because I have a number of clients who will come into my office and they'll be having this conversation and they'll be going on and it goes back and forth and it's positive and I'm like, why do you guys need me? I'm not doing anything here. And they're like, we can only do this for whatever
Yeah.
reason. We haven't been able to translate it to our home environment, and maybe it's because it gets too scary, it gets too overly powerful. The emotion gets too powerful, but there's something about having somebody in there that where they can say, okay, we've got this safety net. We know we were not going to get out of control. So fascinating stuff.
Yeah, and I've actually had couples come and they have these fights and it's like they sit on great it's like they sit on this information, they're writing a list of what they're going to say, and
Yes.
right, that's not healthy, but like that's still speaking to like a sense of safety, like
Yeah.
gosh, like with Nick I can share these things with my partner here, so I think it can cut both ways, like, yeah.
Yeah. And you described it earlier. You're like every week that they're coming in to see me, they're not out doing it on their own. And so maybe they transition, right? Maybe they go several weeks without needing to see you, and then they come back in for a checkup.
Mhm.
So Nick, I don't know if you've got, our interview's about done. You did a great job kind of sharing your perspective and how you think about doing couples therapy. Any thoughts you have for people who are thinking about becoming a therapist, or how do you land on this model? Like, how did you land on a model that fit for you?
Yeah, that's a great question. I think um there are some models like, okay, strategic family therapy. I think that, the whole thing is about manipulation, which is kind of fun sometimes to think like, oh, I'm going to manipulate these people. But if you think about that, if you're working with a marginalized group of people, that's kind of the last population I want to manipulate. And so it was like really hard for me to think of, all right, how would I use strategic family therapy with a group of people that may not often come to therapy? Okay. But I guess like what I'm saying is like keep your mind open to it. Really try to soak. You're gonna have these moments where you're learning about a theory, and it's like, gosh, geez, like my experience with strategic family therapy in a marginalized group, where you're like, geez, I don't know if that's speaking to me or, but it's still important that you're familiar with it. And so just as you grow in your training, and I really think therapy, it's like a craft. It's like a, like a really, we just had the Oscars. It's like a good, you're an actor, you get these parts, each part is teaching you something, right? And so like just play around with these models at your internship. I think supervision is such a wonderful place to kind of put on these hats, ask questions with your supervisor. Um, Expose yourself to different trainings of people doing this model. A thing that was helpful for me in EFT is number one, I think Sue Johnson's book is a really wonderful book. She lays out all the steps and all the phases really good. But, think about the externship with EFT. The Twin Cities community has a very strong EFT community too. You could, if you're really interested, pick someone's brain who's practicing. I think they also have, I believe, like once a month, there's like a consultation group that you could do. So there's lots, I think, different ways that you can get involved. But really, just I guess my biggest piece of advice is just stay open to all these models. As a professor, I teach these models, and I start with saying like, some of this stuff's going to really speak to you. Some of this stuff is going to like, I don't like it, but like you have to be. It's I got a through a 14-month-old, so we're trying to like expose them to all these different foods. It's kind of like the same thing. You're going to land on something that you like. And also too, over time, your life changes, the population you practice with changes. Be open to the fact that, the model you like now, it might be something different. When I left my master's program, I was really interested in DBT and helping people with personality disorders. And now I'm doing lots of couples work and it's really rewarding. So just understand it's going to change.
Different.
Couldn't change too, so
Yeah. Hey, Nick Newstrom, Syracuse University. We appreciate you being with us today. Thank you so much.
yeah, thanks, Steve.